Hey, Marissa, welcome to the show.
Hey, Brittany, thanks for having me.
Yes, I am happy to have you here. We met at that Bio Insiders table where we led a discussion about how COVID-19 has infected. Oh my God, can you tell? That's affected.
Well, it has.
affected healthcare investments. And, they asked me to moderate it and you were there and I heard what you were working on. And I was like, excuse me, in your DMs, can we have an interview? You sound like someone I need to know. Did you feel the same?
Yeah, well, I already pre-looked you up and I already knew who you were because I was following you. So I was like, oh, hey, she's gonna be moderating. Click, 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 click. I'll be there.
Oh my God, that makes me feel really cool. Yeah, there's definitely a lot of people now that are like, hey, I love your show. And I'm like, oh my God, you listen to my voice every week. It all blows my mind. I'm like, I'm just some lady sitting around with 3D printed clitorises in my freaking spare bedroom, just talking about women's health. Okay. That sounds way creepier than it is, though. Way creepier.
A little, yeah. But I mean, in the femtech space, that's totally normal to us.
Totally normal. Well, let's kick off the interview. We always love to learn more about our guests. Where are you from? What did you study? Did you have a career before you got into women's health? Tell us your story.
Yeah, for sure. So I'm in New York City, week 742 in my apartment in New York City. So I'm sure everyone understands that. But and it's been great. So I'm an engineer by background. I went to school for engineering and I went straight into the healthcare industry, not focused on women's health. I kind of, didn't know much about it. And after several years, I joined a women's health company. And I just thought it was a great opportunity. I wasn't seeking out a women's health company, but engineering in operations and manufacturing and new products. I did a lot of work in mergers and acquisitions, and I moved. I was grateful to move to different countries with the companies I was working with, and so I was able to see the developing world. I was able to see what was going on, and so I spent 15 years in corporate. And for the last 6 years, I've had my consulting advisory firm that I've been running, and also HERHealthEQ that I founded about 4 years ago, and actually 5 years ago now, as the years keep ticking up. Yay! And so I never knew about women's health. It wasn't really a niche area anybody talked about. I mean, I was barely in an area that anybody talked about. I was an engineer. I remember that my grandma was like, so great, you drive trains? And I was like, no, there's a little different.
Grandma.
Yeah. But I kind of never knew about it, never thought about it. And I was grateful to work at a company that's all that they did. So yeah. I kind of fell into the space, luckily.
Do you think that we need more engineers in women's health?
100%. We need more engineers, period. Especially more engineers in women's health and more female engineers. Mm-hmm. It shouldn't be inclusive that a woman or an engineer that's in femtech or in women's health needs to be a woman. They don't. Mm-hmm. It's just, it helps, but it's not necessary. Certainly there needs to be men in this equation as well. And so, but always more female engineers. And quite honestly, women are more adapt to being engineers, even though we're told that we're not in elementary school, or at least when I was in school. It wasn't a thing. Now it's obviously far more equal and inclusive, thank goodness. But there are full countries that are graduating more women engineers than men, which is admirable and amazing.
So I feel a little bit like your grandma. I'm not thinking trains, but I do want to clarify, because if I have a question, I always assume most of my listeners might as well. So when I think engineer, and it's not about trains, I think biomedical, which is med device engineering. And then we have an intern, she's industrial design. So she's designing, cool ergonomic chairs and bras mm-hmm. and stuff. And then I have heard of a bunch of founders that want to do physical wearables, right? And they're we need a hardware engineer. We need somebody to make a circuit board thing. Are those the engineering you're talking about?
Okay. Yeah, absolutely. And those are all just titles of engineers.
Okay.
And not everybody necessarily has to be an engineer. I graduated from a manufacturing engineer degree, which quite honestly is a mix of all of those combined because I couldn't pick one. So I just said, let me just get the mix because, and for me, like I like to be practical. So what's going to be most effective? What's going to save money? What's going to be able to be manufactured? What can we get out to consumers? To me, that was interesting, as opposed to one tiny little molecule, which there needs to be. That just wasn't me, you know, personally. So yeah, no, engineers are very, very diverse, and you know, all the things you said, like their titles, their engineering titles.
Okay, cool. Thanks for clarifying. Yeah. Well, what is HERHealthEQ?
Well, that's my favorite question known to man. Well, thank you.
Mike is yours. What is it?
Yeah, so HERHealthEQ, we are a nonprofit social enterprise, and we create health equity in developing countries all around the world by providing resources women need to detect non-communicable diseases. And these are medical issues that are really easily diagnosed and treatable with the right equipment. And so we provide medical devices to developing countries. We focus on women's health. So just as a quick snapshot, that's kind of what we do. And we work with medical device companies, we work with hospitals, and we get the equipment to multiple countries throughout the world.
Oh my gosh, I'm really excited about this. All right, so a few clarifying questions. What is a developing country? Can you give us some examples?
Yeah, of course. So it's you know, I think a lot of people have heard of like first world, third world. There's actually a second world in between the first and third worlds. And so a developing country is not the poorest of the poor, not the wealthiest of the wealthiest. So it doesn't necessarily include Europe or most countries in Europe, the United States, Japan, you know, very industrialized countries. We focus on the developing world, the emerging markets, because non-communicable diseases are a thing there. You're not dealing with food insecurity as much, you know, it's always present. You're not dealing with food insecurity, shelter insecurity, water insecurity, hygiene, things like that. Those have been more or less taken care of. And they've kind of reached this like middle ground of, hey, we have basic healthcare, and now we're living longer thanks to advances in all of these other things. And now we have more disposable income to buy crappy food, and probably that's not so good for you and sugary, or we're living longer and we're getting these what they call diseases of affluence, but it's not really. I mean, cancer, diabetes, heart disease, maternal health is still really a big issue. So a developing country, quite honestly, it's about 2/3 of the countries in the world.
And what are some of the countries that you work in specifically?
Yeah, so we are in, let's see, Vietnam, Tanzania, Jamaica, Costa Rica, Burkina Faso. We just facilitated donation, actually our first one to the United States, to an area that's really disadvantaged. And Costa Rica, I think I said. And we're about to launch a big program in India, in Mexico, I think potentially in Argentina. So just some examples, Kenya as well. So it's not just, you know, I don't want people to think like, oh, this is just Africa. No, it's literally the entire world that we're talking about.
Yeah, I interviewed the founder of Days for Girls, and they help with period poverty. And I was like, so where in Africa are you helping? And she's like, we're helping in New Orleans. And I was like, oh shit. She's like, there's a problem here, you know? And what is a non-communicable disease?
So it's a disease that it's not like you're going to get it through a cough or through blood. Or, you know, non-communicable means you're not going to transmit it. So you might just develop it either through environmental factors or genetics or things like that. And they include, like for us specifically, cancers, different types of cancers, which very often are not, you can't catch a cancer. There are obviously viruses that are causing certain types of cancers, and we work in those. But on the grand scope of things, you can't catch it. So cancers, diabetes, heart disease, internal health issues, things like that. And they can dramatically be reduced with routine screening, which is where the equipment comes in.
Got it. And why did you start this? Are you just like passionate about shipping heavy equipment around the world? Like, why did you start this?
Yeah, no, I am not passionate about shipping heavy equipment around the world, certainly. That's actually the hardest part of what we do. Yeah, thank God for our partnership with the UPS Humanitarian just recently, because, I don't actually want to deal with that. But I started this, I fell into it. I fell into working with a women's health company. I took a position in Costa Rica and I loved it. I was working there as an expat. And I had a conversation with a friend at a bar. She told me that women were dying in this whole other region. And quite honestly, it was because their mammogram machine broke down. Right before coming down to Costa Rica, I just finished a very, very large program with that same company that I was working for. And we just launched our 3D mammography system, the first in the world, the one that's out in the world now, and the first ever with Hologic. And I rolled the first one off the production line. And I knew part of the program for getting these out into the world was that a lot of these companies and hospitals would be bringing in their older devices and getting a discount to trade into to upgrade. And then I was like, oh, okay, great. Well, we have them sitting around our warehouse. Let's just get you one of these. And, naive 30-year-olds, like, no worries, I'll get it for you, call you back in an hour. And so that kind of started this. And then I thought, like, we are working in this country. Like, why wouldn't we start to give back? And then I knew also that we were throwing, like every company, and this is not specific to one company, every medical device company is throwing equipment away. It's returned, it's scratched, they changed the marketing. It's, the second generation, and now they're on to fourth generation. It's like our iPhones, like, what do you do with the old ones? And so I hated this concept that we were throwing things away and throwing away perfectly good equipment. And so I knew, like, Costa Rica, one of the most well-off developing countries, quite honestly, had this problem. So then I just started thinking, like, hey, what other countries had this, and what other medical device communities and companies had the same excess? Yep. And so I started HERHealthEQ many years later. I started it like after I left corporate, after our 2 jobs after that, and because it was always bothering me. And like, oh, what to do about this? And so I was like, oh, I'll start a nonprofit.
And what has that experience been like? I feel like in my mind, I'm like, is this similar to how, grocery stores are like, we can't donate food to homeless people, like they'll sue us. And then that's never been the case. Is that something similar here? Like, do you face like hesitation by companies to say like, oh, well, we don't want to donate it or whatever? Like, are there barriers there?
Thankfully, not as much.
Oh, good.
So most companies are very, very open to donate equipment. There's obviously things that we have to sign, things that we make other people sign. Thank God for lawyers and their job security as well with all these forms. But from most of these medical device companies, they're relatively charitable. They understand that this is a problem. Some of them have their own foundations to do this. But not every company wants to put the effort to do it. And so it's as if we're almost like a middleman. We have the connections in the developing worlds. We're continuing to grow them. We are a nonprofit, so we're able to do it. And so they really want to, there's nobody that we talk to that's like, ugh, this is a horrible idea. It's now just getting into the mechanics of the company. That's like, figuring out where in the supply chain can we get in? How do we get the equipment? How is it make sure that it's recertified? We have to make sure that's in working order. Like, we don't want to send trash to another country. Like, that's just a waste. So we make sure that like everything's working and it's recertified. And so, there's a lot of inner workings associated with it. But no, on the grand scheme of things, they are very, very charitable and open.
And do you ever find that like the machines are not going to be compatible in the developing country? I know that I've heard a story once about there was some African community saying we need NICU, like those beds for NICU babies. And America was like, we'll provide them. And they like sent a bunch over that required like 5 plugins and like all this special equipment. And these African communities were like, why the fuck did you send this to us? Like we can't plug this in, you know? So do you ever face that incompatibility?
Yeah, so it's something that we were aware of. We were highly aware of it. I learned about it when I was in Costa Rica. Like, you know, I mean, we had to dig a trench to get wires, you know, to the hospital that can support the voltage that needed for a mammography. And I was like, oh, okay, this is a problem. So we do like a site survey before. We do a survey of the location. We also then obviously speak to them, you know, whoever is donating the equipment to us, you know, what is the power requirements, what it is. And if there needs to be some sort of converter, there needs to be something, like we'll provide that with that, you know, with them. And that everybody knows like what's coming. Like it's not a surprise, and it's going to be like a whole entire package, but we do it through a lot of diligence. And, you know, there's places that just don't have the infrastructure to support certain types of equipment. And, you know, unfortunately, we have to say that it's not going to be compatible at this time, unless there's some infrastructure upgrades that they can do. So, you know, sometimes it's so easy, you know, that it's something like we're just plugging it into a wall, but sometimes it needs like crazy amounts of voltage or power. Sometimes it actually just needs a battery charger. So, especially as things get far more mobile and smaller.
Yeah. This sounds like it could be for all genders, right?
Yeah,
but
totally.
Your company is called HERHealthEQ. So why are you focusing specifically on women's non-communicable diseases in these countries?
It's 100% an issue for everybody. I don't want to diminish that. We focus on women specifically. I'm a woman in STEM. I'm very aware of that. I promote STEM education. I want girls to go to school. And I realize in developing countries, the girls are not going to school because they're the first ones pulled out when somebody is sick in their family. And so in order for them to go to school, their mothers and their grandmothers and their aunts and sisters, they have to be healthy. I'm in healthcare. I've been in healthcare my entire career. I can solve the health issue. I personally cannot solve the education issue. It's not something that I knew or I understood. The other side of it is, again, I worked in healthcare. It was an easier solution. So it's something that I can work on. And then the other side of it is that 90% of a woman's income goes back to her family, while only 35% of a man's salary goes back to his family.
What does he do with the other money?
Well, I mean, you know, has a good time, gambles, drinks, and that's a gross overgeneralization, and I understand that, but there's like studies up the wazoo. And for us, listen, we want economic empowerment for these women. Like if they're healthy, they A, send their girls to school, B, are able to work in whatever industry or informal industry that is, and C, they alone can bring their entire family out of poverty. And D, it's not just a woman, it's an entire community. Women work in communities all over the world, most especially in the developing world. And so it just made sense. And like, I'm a woman, you know, and women don't have access as well to all, you know, it's a societal thing. So women don't necessarily have access to all of the healthcare services. So, and you know, it's sad to say, but like women's health is just a little bit more complicated. Like we have lots more internal stuff to deal with. And, you know, with childbirth and all of these other things, like there's just a lot more to think about and worry about in a woman's health.
Yeah. Between our menstrual phases, having it, not having it, not having it because there's a problem when we should be having it, you know, the consequences of those hormone changes, and even women's safety, you know, like their physical safety and what they have to be concerned about and that kind of stuff. I totally agree. We totally agree at Femtech Focus. It's why our tagline is women's health is everyone's health. And I like to always say, like, also everyone's health includes the economy and Mother Earth, like sustainability with menstrual products. Like we literally target the woman and everything else will like fall into place, is my belief. You were talking about the mammograms. Can you give us some other examples of other like devices that you've helped share?
Yeah, of course. So ultrasound machines, fetal monitors. One of them just actually went out in the mail just this week. Also things to treat and detect cervical cancer. So a colposcope, cryotherapy, thermal ablation to treat cervical cancer. We're starting to do a lot more work. So ultrasounds are helpful in many, many different conditions. So that's always great. Starting on diabetes as well. So dialysis equipment, and then monitoring, and EKG machines, just to monitor your heart health. There's tons. There's literally tons of things. We don't deal in like durable goods. So like gauze and syringes and scissors and all of those things. There's incredible organizations that do that. And it is entire logistics chain just to figure that out. And they're amazing at it. We don't want to be in competition with them. We're not in competition. We all work together. Yep. Our specific niche is equipment, or like things that you would see in your doctor's office or in the hospital, like anything that you typically don't throw in the trash is considered medical equipment. And that's kind of what we deal in.
Like those things with the little light and they tell you to open up and then they put the wood stick on your tongue, like even that thing.
I mean, that is considered a medical equipment for sure. That's a little bit more, durable goods because there's around, but that itself is it's considered a medical device. Yeah.
Yeah. Interesting. Yeah. Cause usually I go to like next gen sequencing machine to find out, and I'm like, oh yeah, it also probably is just like that light thing that looks in your throat.
Or like a blood analyzer, like even like a centrifuge.
Oh my God, centrifuge.
It has to spin it. It's such relatively ancient technology.
Yeah.
But like nobody thinks that, every lab needs something like this.
Yeah, 100%. So you're a nonprofit. How is this funded? Like, is it grants? Like how is this supported for this many years?
No, thank you. So it's private donations for sure. Like philanthropically is always, the best. We do have, of course, some grants. We have corporate partners that support us and are always looking for more. We have also recently transitioned into a social enterprise, which means that, it's a tag phrase, quite honestly. It doesn't mean anything. We're still a nonprofit. Nothing changes around the way who we are. But in order for us to be sustainable, we have started to charge for the equipment at a much lower rate. Mm-hmm. And we were providing service and installation and training and monitoring and all of these things in alignment and in alignment with who we are as an organization. And so that will start to become a revenue stream for us, which is 100% compliant with nonprofit rules. Mm-hmm. Almost honestly, a nonprofit's a corporation. It just means that, like, personally, I'm not rich, which is fine. I'm rich in the work that we do, certainly. And we've also just started to open up an arm of our business that can be invested in. This is capital equipment. And obviously we have revenue coming back. And so a separate side of our business can be invested in, which is exciting for us. It's nerve-wracking, certainly for me as a CEO, but it is exciting for us. Because the more impact capital that we have in the organization, the greater impact we can have.
Yeah.
And that's really important. And nonprofits don't necessarily always have to be just like, waiting for money to come in and please give it to us. And like, we hope that you do. I'm personally am a corporate person. Most of our board members, we are corporate people. And it's, it's really hard to continue to ask people for money.
Yeah.
And, and the other side of the thing is corporations, like, they technically have to give money. Like these are tax incentives for them. So why would you not support a company or an organization like ours, or so many out there that are doing great work? You get the benefit of it, of the PR and the tax write-offs and all of this, and we're doing the work. So we value corporate partners really highly from our perspective.
I'm laughing because Femtech Focus is a 501c3 nonprofit, and I am a startup girl, man. I am a CEO, and all of my little business models and my financial things. Thank God I have amazing advisors who've had careers in nonprofit for a long time. And they're like, where's the line in this Excel sheet that says like donations? And I'm like, oh yeah. Let's add that in, because I'm like, from day one, I'm like, how are we going to make money? What services can we offer that, because nonprofit, you can't have a percentage of your income from, services. But yeah, it's definitely been a mind shift for me. My advisor's like, why are you not asking for donations at the end of your podcast? And I'm like, oh yeah, I should ask that, like NPR, like support your local NPR. And I'm like, oh yeah, okay, I can do that. So it's definitely a mind shift.
It's a mind shift change, but it's also one that you shouldn't get so far into just because, a nonprofit's a business. Mm-hmm. And so, donations are very, very important. And there's so many incredible people in the world that do want to support nonprofits. Yeah. And it's a big part of who people are. And I appreciate that, myself included. But, it's also a business and you have to be sustainable.
Mm-hmm. Yeah, no, it's whenever we do get a big donation on our website, like just want to cry because I'm like, oh my God, they see what we're doing, or like a corporation reaches out and they're like, how do we get involved? Like like, this is so important. So
I know I send out like a big text chain. I'm like, hey, this one came in.
Do you have any statistics on like how many pieces of equipment you've sent?
Yeah, of course. So we currently to date have sent 9 pieces of equipment out. We are in 6 different countries. We have deployed $71,000 in medical equipment.
Wow.
And I think we've treated and we treated over 41,000 women.
Wow.
Which is really awesome. We are growing like crazy though. So those numbers are really going to be moving. We have a massive goal to impact the lives of 1 million women by the end of 2025.
Oh, I love it.
So lots of work to do, but we're ready and excited for it. It's, it's an audacious goal and it's a small drop in the bucket. I mean, there's 2.7 billion women in developing countries. 1 million doesn't mean a thing, but to each individual woman, that's a big deal. And to us, like, that's kind of what I think about every day.
Well, I wanted to ask you about your future goals, and I
sorry, I jumped the gun.
No, you're fluid conversation. We all know that. So, I love that you have like a quantitative goal. I'm all about like quantitative, like we want to hit this many downloads, or we want to hit the, so that many women. That's amazing. Do you have what are some future goals, like maybe like certain equipment that you are still like haven't been able to get your hands on yet that a country needs? Like, what are some other ones? Because we do have thousands of listeners. Maybe somebody out there has it, right? So shoot your shot. Tell us what you want.
Yeah, I mean, to hit those 1 million women, we need to deploy over 200 pieces of equipment. And so we are always looking for medical equipment. Like, that is never going to stop. Everybody needs it. And listen, like, if we go over 200 pieces of equipment or 1 million women, like, we're not stopping. Like, I'm not closing the company when we're done. Like, when we hit 1 million, we just like keep on going. I just, I just want to make sure that we're focused for a little while. But the plan is, we need ultrasounds, we need mammography equipment, we need, fetal monitors, we need colposcopes, cryoablation, thermal ablation, we need EKGs, dialysis equipment, diabetes monitoring. I mean, like, just keep going. Like, anybody, if this resonates with you, like, reach out. I'll tell you if it works for us or not. Laboratory equipment is really important. So that's another part kind of that we're working to get into, because it supports a lot of the work that we do for diagnostics as well. So laboratory equipment, and it doesn't have to be the fanciest. Like, let me put that in perspective. Like, it could be 5 years old. It could be 7 years old. Like, if you are upgrading your lab, you're upgrading, you're in a hospital, you're upgrading your equipment, you are at a medical device company, and hey, version 17 has come out. Well, I'm totally cool with like version 13.
Yeah.
I'm sure that it works. Mm-hmm. And let's just find the right plugs to make sure it plugs in. And that's about it. Like, we're open to finding homes for the equipment that is given to us. And it's not our intention to run a massive warehouse. Like, it'll house something maybe for a few months while like we're working on moving it around somewhere. But like, I'm not interested in running a warehouse. That's not the fun part of this job.
Your New York apartment is not big enough for all the centrifuges.
No, certainly not. Nor is our storage space that I keep upgrading. So no.
And if somebody is listening and has potentially a connection or the device for you, how do they get in contact with you?
Yeah, for sure. It's Marissa with 1 R 2 S's at HERHealthEQ.org. Or you can go to our website, HERHealthEQ.org. Reach out to us or info@HERHealthEQ.org, any of that. Please reach out. I'd love to hear from everybody.
So amazing. Well, we have 2 last questions that our listeners really love. The first one is, we have a lot of aspiring femtech founders, which I am so proud of. A lot of university graduate students, people in corporations that are like, I'm done making rich people richer. Like, I'm on to solve a problem. What is an area in women's health and wellness that still needs innovating?
All. The answer is all areas. But the one that like I can highlight that probably a lot of people don't think about is equipment. No, everyone thinks about apps. Everyone thinks about digital health and connected health. And it's great to be told that you have something, but like, then you need to fix it or you need to treat it. So, which again, goes back to equipment. And so how about, let's think about equipment that's made for developing countries with their needs in mind. What we have and that's developed in the States or in Europe or wherever is not necessarily applicable to somewhere else. And, one quick example is that here we're very fancy with our pap smears. In most developing countries, it's actually, and it's generally far more efficacious. There's a vinegar solution that's used. Vinegar it's cheap. You can get it. You get an entire bottle for $1 and you can probably treat hundreds of women.
Wow.
Like, let's think about innovation. Like, that's just a very simple example, but let's think about examples of equipment. And so every area needs innovation, but I'd really love if there's anybody out there, and I love to talk about it. Like, I'm an investor as well. Like, I want innovation to move forward. I sit on the board of multiple companies. Like, this is important to me as a person. And so if there's medical equipment that's out there or that you're thinking of developing, like, let's think about the greater world as well. There's a whole world out there.
Yep. We had our summit on Monday and
I know it was awesome.
Thank you. If you missed it, become a FemPro member. You can watch the recordings. Okay, y'all.
It was awesome. You totally should.
And in my Femtech landscape talk, I talked about, like, we have an issue in Femtech where we're designing for the affluent white woman, because I don't think that's because everyone in Femtech is like, that's the only person that matters. I think it's a systemic issue of that's who is most often funded. When you go to Silicon Valley saying you're going to make a med device for cervixes in the Philippines, that's strongly to the Mark Zuckerbergs of the world or whatever, right? And it should, but it's a big systemic issue. If anyone knows me, comes to my lectures about fundraising, I think it's a big game that needs changing. We shouldn't be dancing on stages like, like. No,
but you just highlighted that the market's now 1 trillion.
Yep.
This is not like, this is new news for everybody, and quite honestly, it's not new news to any of us in the industry, but it's important that you highlighted it because it is a huge opportunity and it's a huge market. And I have no idea why people are not paying attention to it as much as they should, besides the buzzworthiness of it.
Yep, absolutely. 100%. Well, that actually brings us to our industry question. What do you think the Femtech industry as a whole needs the most right now in order to be successful?
Money. We need investment. We need people who are willing to invest in interesting technologies that help the Femtech world. And, my perspective is Femtech is full women's health. There's nothing to do with one specific organ. So we need investment, period, end of sentence.
I love it. Yep. That seems to be the call to action. I ask everyone that question at the end. We've done well over 100 at this point, interviews. And I ask that question, and I mean, 9 times out of 10, it's money. So I hope that we are hitting it home, y'all. If you know where the money's at, tell them to put it over here, because even if you don't care about vulvas, we just told you it's $1 trillion market and you can make a ton of money. So if capitalism is all you care about, I also don't care. Just still fund us.
Right. 100%.
Just don't sit on our board, like let you and I sit on the board, but you just fund it, Yeah.
I agree.
Marissa, this has been so much fun. You're awesome. I'm so glad I met you, and you're doing really awesome work, and, keep it up. Let us know how we can help. This is awesome. Thank you.
Thank you. You're doing incredible work. Thank you so much.